to talk about a very hot topic, non-surgical skin tightening. What are the hypes? Does it exist?
This is a really loaded topic. As everybody knows, it's almost like we all want tighter, firmer, bouncier skin, but really, who wants to do a facelift? Who wants to go under the knife? Really, I don't think most people, it's not really at the top of their list of things they want to do.
Maybe the contemplative phase for a surgical is you either know or you know, or sometimes you might contemplate it for 10 or 15 years. But in the meantime, when you're deciding whether you're going to or not, what are our options?
Well, let's back up first and really talk about skin laxity. So what does that mean and why does it happen? So skin laxity really refers to this process where the underlying structural elements of the skin and the tissues under the skin start to change over time. So in the skin, we're really talking about our collagen and elastin bundles that provide the shape and the stretchiness and the bounce of the skin. And then under the skin, which is the fat layer that our skin sits on, the muscles, the tendons, the ligaments, and the bones. So there are many reasons that these will start to change over time and eventually cause that dreaded, saggy, loose, droopy skin that we hate.
So shall we start from the bottom up or the top down?
Let's start talking about the causes. So let's think like in general, what are the different causes of skin laxity? Why does it happen?
So top down, main one is sun exposure, UV exposure. UV can penetrate actually quite deep into the skin, and it affects thickness or thinness, the crepiness of the skin, the attachment of the epidermis to the dermis, so it can get very fragile and stretched out actually. What about the dermis? What about the collagen in the dermis?
So we know that UV light actually really will damage those collagen fibers, and there's some amazing slides you can look at under the microscope that shows how the entire three-dimensional structure of those collagen bundles, that is literally what we see when we look at skin, get destroyed by sun. So much like if anybody's ever had like silk curtains by a sunny window, you can see over a period of 5 years that fabric basically gets destroyed. That's what the UV will do to your collagen bundles over time. Then there's just aging in general. So we know that as we kind of roll past our 20s into the 30s, the natural amount of collagen production really does decrease over time. And then in menopause in women in the 50s, once our estrogen levels drop, the amount of collagen reduction has been reported to be at least 30% decline in the quality and the quantity of collagen over a 5-year period of time. So that is actually the architecture and the structure of your skin, which is literally disappearing over time.
There are other factors that maybe people can control for or not control, which is diet.
Lifestyle,
Lifestyle, there's a good diet and a poor diet outcome for skin. Certainly the quality of the protein, extra collagen, nutrients, antioxidants, they can all lend a hand certainly.
Like the better the diet, the more nutrients. We know that those cells in the skin, which is fibroblasts that are producing collagen, they're going to be healthier and perform better if they have the right nutrients.
And let's not forget, nutrients then help with muscles and bones. Our bones are shrinking. The bones in our skull are shrinking as well. So good teeth, good gums, good bones for our jaws and our bones in general will actually make a difference in the long run.
Exactly. So you can imagine that if we're not taking care of ourselves as we get older, our bones will get smaller faster, the muscles will start disappearing, and then the skin doesn't really have a solid base and a solid structure to sit on. So all of those things over time is really what's going to cause that looseness, the laxity in your skin, and that dreaded saggy droopiness. So let's talk about treatment options. So we know that broadly there's 2 categories. So there's surgery that can be done, and then there's non-surgical options. So let's first talk about surgery, pros and cons.
Well, it's all done in a matter of hours, and then you have 2 to 3 weeks to recover, and you look like a really tight, different person afterwards if everything goes as planned and there's no complications.
Right. I mean, look, a lot of people
Yeah.
love surgery, and rightfully so. You can have a very dramatic outcome. It can look great, but there definitely are safety issues to consider. And of course, that will depend on the patient, but complications, unfortunately, are a very real thing, even in the best of hands. Infection, bleeding, an undesired aesthetic outcome, which could be permanent. So there's very real risks to consider, and we always encourage patients that if you're really worried about drooping or sagging, get an opinion and really consider the options very, very carefully. Okay, so let's say you've done that, and for whatever reason, you've ruled surgery out, either for now or forever. But let's say you've ruled it out and you're like, okay, but I'm here today, and what can I do?
How to take care of your skin to prevent that sagging and or treat the sagging.
So let's talk about non-surgical options. We all know there's so many things out there. There's a ton of hype, all different kinds of machines, devices, in-office treatments, things that you can do at home on your own. You know, it's a difficult area, and really what we like to think about, it's about expectations. So going into an office, even for an in-office treatment, you're not likely going to get the same kind of transformational change that you would see with surgery. So understanding that is really very paramount.
So there's a lot of confusion out there, and I think that the promises that some people have come to expect sitting down in consultations are not exactly maybe what will be delivered.
Exactly.
So let's talk about then maybe what we can deliver. How do we approach it at Kingsway Dermatology?
So again, it comes down to first understanding the patient needs and expectations, and understanding really what our target is and what we're looking to do. So for example, one of the devices that we use and really find we do get great results with is doing an ablative fractionated treatment like the Sciton's ProFractional. So that's a treatment that we've done particularly in areas like around the eyes, around the neck, where we find that because it is an ablative treatment, we do see that there's definitely results that are seen. It's not what we would call an introductory treatment, so there's definite downtime with that. There's some crusting that can happen, there's swelling. Patients have to know and expect that there's going to be some downtime, but for sure, if people are looking to make a change that's very visible, that is one of the options that we know will definitely help.
The beauty of using the ProFrac on a full face is the ability to create a customized density and a depth that works for their skin. So it has the ability to be 300, 400, 600, 900 microns thick. So it can go with one pass or two passes in a few areas, really deep. And the recovery then, as you say, it is still a little bit of downtime, but it really does work and it's quite comfortable.
An added benefit is because it's so precisely engineered, we feel comfortable enough using that device on other areas. So we've used it with success for patients, for example, that have laxity around their bellies. Let's say women after they've delivered. It's actually a very effective treatment in helping to build new collagen and smooth out that laxity. We often can combine it with other modalities. So for example, once we've made those little micro channels with the laser, we can add PRP type fluid to it, which helps get even more collagen stimulation going. So definitely this is a tricky area. We all want tight, firm skin, and we want to get rid of that sagginess. A difficult area, there's a lot of hype there, a lot of promises, and so many different machines, even at-home things. A lot of that is really marketing. So again, it's very important that you seek out a qualified provider, really understand what you're looking for, what you're willing to do, what you're not willing to do, really understand the parameters. I'm Dr. Elena Poulos.
I'm Dr. Marnie Fisher. Thank you for watching, and we appreciate comments, any questions, and we'd be happy to answer.
Thanks so much. We look forward to hearing from you.
Bye.
Bye.